If you're a woman who experiences depression, the source might be your birth control. More than 140 million women worldwide use a birth control pill. That boils down to roughly 1 out of every 4 women of reproductive age using an oral contraceptive. While birth control pills are 99% effective at preventing pregnancy, they are not without side effects. And while most women know about the physical health effects of birth control pills, few are aware of the link between oral contraceptives and their effects on women's mental health. To learn more about the effects of oral contraceptives on the moods of women, researchers conducted a study wherein they compared 28 women on birth control pills with 14 women who were not on birth control, as well as 29 men. Participants were between the ages of 18 and 35, and none of them had a history of depression, anxiety, or taking antidepressants. The results showed that the women who were using oral contraceptives had shorter attention spans and had trouble concentrating on tasks when compared to those who were not using birth control pills. Researchers suggest that these women could potentially be more vulnerable to mental health disorders such as depression and anxiety. There are various types of birth control pills, and they are available with different combinations of doses and hormones. Synthetic hormones in birth control pills work by decreasing the levels of progesterone, which suppresses your monthly ovulation. However, progesterone is a happy hormone. So, the less progesterone you have in your body, the more vulnerable you are to mood swings and, in severe cases, depression and anxiety. Depression is one of the most prevalent and debilitating mental disorders, and affects twice as many women as it does men. It is estimated that 1 in 4 women will experience depression in her lifetime. Another massive study showed a strong connection between birth control pills and depression in women. Researchers followed a total of over 1 million women between the ages of 15 and 34 for 13 years, and found that those who used the pill were more likely to be diagnosed with depression. Teens between the ages of 15 and 19 who used birth control pills had an even higher rate of depression than older women. In fact, they were nearly twice as likely to be diagnosed with depression than their peers who did not use contraceptive pills. Women who have a family history of depression are at higher risks, but it is important to remember that everyone who uses hormonal birth control becomes vulnerable to mood disorders. While this is certainly worrisome, it doesn't mean that every woman who takes hormonal contraception will become depressed. Millions of women use hormonal birth control without ever developing a mood disorder, so there's no need for you to stop taking it unless you start to experience some of these side effects. And even if you do experience these side effects, always consult your doctor before changing your medication habits. There are many other birth control options that do not contain hormones, and they are effective if used correctly. And ultimately, the type that works best for you will depend on your personal health and circumstances.